The strongest feeling I have right now is I think I have a sense of urgency. I just want to get the operation completed now.
Every patient needs special individual care. So we try them to feel good and sure before surgery. That's why all the procedures for hearing implants are not only one-day procedure. We invite them earlier. We present what is connected with the implantation, what they could expect later, which are the steps after the surgery. The surgery is one piece of the cake. Later there is very important rehabilitation, how to care the skin, the hearing, and the all rehabilitation procedure that at the end, after several years, patients and we could tell that it was the right decision with the good benefit.
How I'm feeling about all this at the moment. I arrived yesterday. I'm feeling fine. I slept well. Obviously, thoughts about the surgery do cross my mind, but I know I'm in a right place. Coming to the facility and familiarising myself with the setup and having the tests done by the team, it was a very important and very good thing for me to do because I feel much more comfortable in this environment now. So the clinical team so far have made me feel very comfortable and given me a sense of confidence that they know what they're doing. The whole team has been very good and very welcoming, so there's no one person that I can say. The whole environment's been great. The thing I'm most worried about at the moment is the kind of pain that I might feel afterwards and how dizzy I might be afterwards.
Do you have any questions?
My only question really is the pain level, how much pain I will be feeling afterwards. On a scale of 1 to 10.
It depends on patients. You will have some pain. We will take your medicine to manage the pain.
Yes,
Don't
perfect.
worry.
Yeah, perfect. Thank you.
Typically, cochlear implantation with hearing preservation could take from 30 to 120 minutes. It depends on situation which is in the mastoid. For example, if we have patient after heavy otitis when the mastoid was obliterated, we prefer to be not as fast because we could have some noise in the ear as well. And then typically we prefer that patient will stay after the surgery for 1 to sometimes 3 days for the observation. This is important to decrease chance for potential hematoma.
Well, immediately after the surgery, I just want to be comfortable and at peace. At the time of switch on, after I've healed, I'm most excited about what that first initial sound's gonna sound like. If I could say something right now to myself before the surgery, it would be, you've got this, you've done everything you can to bring yourself to this point and get in the right place for the surgery. Now it's up to the clinical team and the surgical team, so rest yourself and let them take over.